Hello, hello. Greetings all. Please forgive us. We had a slight delay. We had a tech issue, but we are on and popping and excited to see you guys. I feel like, did we meet? We did meet in January. So it's February, and we're excited because we get to bring another wonderful presenter to you. As you're coming in the room, please go ahead and drop in the chat. Just say hi to us. Let us know where you're joining us from. East Coast, West Coast, your city, state, out of space, whatever it is. Hello, hello, hello. Go ahead and fire the chat up for us. Make sure that you're going to everyone, okay? Yay! I love it. The gang's all here. Fantastic. Well, welcome to Enhancing Empowering Conversations for Positive Change. This is our monthly webinar. We're super excited to be here with you today. And because we're running a little behind, I'm going to speed right through. So, D, next slide. Thank you. This is how we engage here on these webinars. Most of you guys, I'm sure, are familiar. However, we'd like to run through it just so to bring the newbies up to speed, okay? When you're ready to speak, please raise your hand. We'll ask you to unmute yourself. And we also okay if you want to come on camera and ask something, we can do that too. Feel free to type your comments in the group chat. Make sure it's going to everyone. If you do not pay attention to that, you're going to send it to just us, the host and the panelists, and we may or may not see it, and then or not see it, but I'll be unable to respond. And please be patient with us. We are expecting a large number today. Yay! So we appreciate the energy that's popping off in the chat. We wanted to continue. So be patient with us. Next slide. These are our agreements. This is how we at East Strong Families, this is how we attempt to create an emotionally safe space. And we know that emotional safety looks different for every person. However, we also want to encourage you to be brave in this space. We want you to jump in, ask your questions. We want you to reflect, all that great stuff. We do it through these agreements. The first one, speaking your own experience, using I statements so that you're not generalizing. We know it's very easy to generalize. It's hard to speak about ourselves. Follow the golden rule. This encapsulates all of our parent cafe agreements, right? So that people feel comfortable sharing. They're not going to be given advice. They're not going to be judged, all that great stuff. And then full presence, please no multitasking. I mean, if you signed up for today, you don't want to miss anything because we have a fantastic presenter. So we know that you could be like checking your emails and all that stuff, but if you do, you're going to miss it. This is lunch. Enjoy your lunch. Take a moment. If you need a minute, take a minute and step away. That's fine. Come back. I see you guys already saying, I agree. I love it in the chat. If you're agreeing to keep this space safe, go ahead and drop I agree in the chat. I need to see like a nice amount of people agreeing before I can move forward. I love it. Fantastic. Thank you so much. Next slide, please. So today, this is going to be just a brief, short introduction because she has her own way of presenting to the world. We are happy to have a friend of Be Strong Families, Dr. Cirecie West-Olatunji. Most of you guys, I'm sure that's why so many people register today because she's, pretty much a rock star. She's the founder of Crest Programs, LLC, and we're super excited to have her as she presents today on structural racism as a detriment to the mental and physical health of young children. And I'm going to turn it over to Dr. Cirecie, and she's going to take us. Oh, I'm sorry. I'm your host, Sarita Sashington, for those of you guys who do not know. And so I'll be taking us through I'll be here to hold space for Dr. Cirecie and just be cute. And then we have D or Lori. Somebody's working tech. Thanks, guys. I'm going to turn it over to Dr. Cirecie.
Wow, thank you so much for such a great introduction. I am so glad to be here. I love this partnership. We were just loving upon each other before the webinar started. It's been, I think, 2 years that we've been talking and engaging and doing different things. And this is one of many webinars I've given, but this will be our
Mhm.
second annual in-person institute. So I'm really excited about that coming up in May. So I'm really glad to be here. And I love having the two communities coming together. I really like that. That's something that happened last year. So let's get started because I have a lot to share. And yeah, so let's see what we can do here. Yes, so again, the title, Structural Racism is a Detriment to the Mental and Physical Health of Young Children. I love focusing on young children because sometimes we overlook them when we think about the environmental factors that influence their emotional, psychological, and physical health. But as you'll see, I'll talk about some of the factors that influence even whether or not they make it here, whether or not they get born. So there's a lot that's going on that we need to be aware of. And whether we're a parent or a community person, a mental health professional, an educator, or just a friend, we need to know what those things are. As Sarita said, I am CEO of Crest Program, and we are a community. We offer online training. We do face-to-face, that's true, and we love meeting people, but we also give people the option of in their own time. We know people are busy, so we've got a host of training videos and credential programs. And so I can just show you a little bit real quick what we offer. We have a lot. There's a lot of training, a lot of training that's available for you, and you can just go to crestprogram.com to our website. You can see all of that stuff. So yeah, here we are. Let's get into it and acquire new knowledge about what are these determinants for young children, particularly young children who come from minoritized communities and minoritized families and so on. So what are we looking at here? So for learning objectives, I'm hoping that you'll increase your knowledge. So in an hour, the best we can do is give you more information. For skills, you probably need to be in an in-person workshop. So today, we're going to talk about structural racism. For some of you, it might be new. For others, it might be a review. And also, there are a lot of different definitions out there. So this allows us to make sure that we're all talking about the same thing, at least for this hour that we're together. And then I'm hoping that you'll increase your own awareness about really how we have been trained and taught with a particular perspective that sometimes hinders our ability to conceptualize or consider what are the issues that we don't think about them. We have a lot of maybe unintentional biases that influence how we think about children, particularly diverse children. And this can be even parents, how they interact with their children. So we've all been influenced by mainstream values and mainstream views that influence how we look at culturally diverse children. And then I'll provide you with some tools. I always like to make sure that after we talk, you can go and do something different, like right after you've been given a tool to do something different immediately thereafter. So let's dive into this. So I'm going to talk about three major things. One, I'm going to give you some definitions around structural racism. And then two, I'm going to help you to identify signs of race-based stress overlooked. This is typically overlooked. Just think back to when we first started talking about trauma-informed care, and we started talking about trauma. And the researchers were saying that even though trauma was very prevalent in people's lives, when they came in to see a physician, when they came in to see a mental health professional, the professionals rarely asked them about trauma. And that was a problem because a lot of times, whatever it is that we're dealing with, whether it's headaches or we're talking about anxiety or whatever, was probably related to some prior traumatic event. So we had to learn to ask about trauma. That's what makes us trauma informed. We realize, wow, maybe we should ask about that because we might be misunderstanding what it is that we're looking at in terms of behavior. Well, race-based stress is the same way. We need to understand that there are a lot of things that particularly people of color deal with that involves uh, structural racism and race-based stress that we're not asking about or we're not considering. So I'm uh, talking about this so that you can increase your skill level. And then, of course, I'll end with the culture-centered solutions, and I'll talk a little bit about why culture is so important. So let's start with the definition. So racism as a stressor. So here you see a great graphic of 4 types of racism: interpersonal, internalized, institutional, and structural. But I really want to focus today on structural racism, environmental racism, and institutional racism. I'm not going to talk about interpersonal and internalized racism. I think we've heard a lot and experienced a lot, whether it's just around gender, if you're someone who identifies as a woman, you can imagine or have lots of experiences of being marginalized, about the glass ceiling and so on. Certainly as a person of color, you talk about a lot of microaggressions that we experience and so on. So not going to get into that. And then internalized racism, just thinking about how people of color has internalized the marginalization. In other words, we assume the position. We do not see ourselves as being fully human or having full human rights. And so we even see ourselves negatively and our reference group negatively. Internalized racial superiority is the fact that people in the majority get lots of signs in society that they are the preferred, or well, really the value system is the one that is preferred, and it's throughout our schooling, throughout our work, our jobs, our housing, etc. And I'll talk about that just a little bit, but really we're going to focus on structural racism, environmental racism, and institutional racism. So structural racism really has to do with a lot of policies and practices. So it's not really about how an individual might interact with you, but it's sort of how the cards are stacked against or for a particular group of people. And I give the example of redlining, of just in terms of where you can buy a house, that there have been policies, whether they were implicit or explicit, whether they were just how people just knew how to behave, or they were actually written on the books, that denied people mortgages. We know also in terms of lending practices, it's difficult for people of color to get loans, business loans, and so on. Definitely in thinking about unequal funding for public schools that are often tied to property taxes. So that's sort of a self-fulfilling prophecy. If the money for schools comes from the property taxes and people live in low-income areas, they're never going to generate enough money to be able to have the kinds of resources in their schools that they need. And so there needs to be some understanding about how do we equalize this? How do we make sure that people get the resources that they need? We know a lot about voter suppression, and certainly during the civil rights movement, there was a lot of attention paid to the issue that poor people had a difficult time voting, that Black people, Indigenous people, immigrants, and so on had difficulty. And then issues around mass incarceration on so many different levels. I'm not going to go into it here, but in looking at multiple groups of people who come from marginalized backgrounds, that there have been different times in US history where there was mass incarceration, whether we're talking about the internment of the Japanese during World War II, we're talking about immigrants or people seeking asylum right now in the US who are being incarcerated. Or we're talking about the school to prison pipeline for many Black and Latino students and so on. So these are institutional or there's societal policies that are developed. This is something that I've been getting into recently, environmental racism, and it really is an extension of the structural racism because it determines where people have housing. For example, where do people live? Generally, poor people of varying ethnic backgrounds, and certainly disproportionately, people of color uh, are are often afforded the opportunity to live in places that where the housing has been built on toxic waste sites. There's lots of research that has come out about the proximity of low-income housing to waste sites and the impact it's had. I live in New Orleans, and we are not very far from Cancer Alley, and that is the space along the Mississippi River between New Orleans and Baton Rouge, where we have the highest cancer rates in the country. And it's related to the multiple petrochemical plants that operate in that span. And you can imagine uh, the majority of the people who are impacted, again, are low-income people, and Black, brown people are disproportionately represented amongst the low-income population. And we have generations of this happening. Uh, Issues around lead poisoning. I know I've worked with the Department of Health here in New Orleans to help people to test their soil in front of their homes, in their backyards for lead poisoning. And so we need to be able to determine how is that impacting our children. The issue of clean water, it's already been predicted because of climate change. It's going to be increasingly an issue that we need to deal with. And this is a very, very significant issue in our Indigenous Native American communities, particularly those folks who are living on reservations. But also we're finding it's creeping into not only rural and suburban areas, but into urban areas where we're having difficulty getting continuous access to clean water, high pollution, and then also we've got the additive effect of natural disasters. And again, I'm in the apex of all of these things here in New Orleans because most people know about Hurricane Katrina that really ushered in this phase that we're in now of uber disasters. And so, unfortunately, we're going to see more and more of these. And unfortunately, um, marginalized communities, even when we're talking about the elderly or talking about people with varying physical or mental disabilities, certainly the population I'm talking about today of young children are vulnerable populations. And those vulnerable populations disproportionately are impacted at a much more significant level to natural disasters than other folks. And then lastly, in terms of us understanding these terms, looking at institutional racism. So looking at some of these institutions, schools, police departments, about, law enforcement and the history of law enforcement in communities of color, jobs, hiring practices. There's a lot of research about healthcare disparities, and I'll talk a little bit about that today as it relates to young children. And then also in terms of racial pay gaps, we could also talk about gender pay gaps as well that we're still plagued with today. So these are ways in which we have these structural differences that have lasting and overreaching impacts on how we live. And as I'll talk about it, how it stresses us out. So, yeah. So all of those things contribute to this issue of race-based stress or race-based trauma. So we're talking about the mental, emotional, and sometimes even the physical strain that individuals experience dealing with racism. And how we respond tends to be passed on through generations. So one of the things I often talk about when we think about the impact of race-based trauma and think about how it causes distress, I often liken it to the slow drip of a leaky faucet. So all the things that I talked about that happened structurally, institutionally, societally, these things are going on and they're happening as we try to live our lives, as we go to the store, and whether or not when we go to the checkout at the cashier, whether they give us our change in our hand or they drop it down on the counter, about the kind of service that we get, about going into a store and asking for assistance to locate an item that we're looking for, as we apply for jobs, as we apply to schools, as our children sit in schools and raise their hands. Is there an expectation that they know the answer to any questions? Just living our daily lives, right? It's like a leaky faucet. And I created a video, a short video that tries to explain that to people who don't understand about how pervasive it is, how it's a minute-to-minute experience, an hour-to-hour, day-to-day experience that we wake up to in living in this world. So it's called a slow drip of oppression, and it's on YouTube. It's for free. So it's important for us to think about how are all these things stressing us out, and what does that have to do with young children? So, what are we seeing? What are these things that are stressing us out? What should we look for? What are these things? So we've got issues around how do we cope? And we can either have adaptive coping or we can have maladaptive coping. The adaptive coping are things that make it better, right? And then maladaptive are things that make it linger, right? So, if we think about maladaptive, numbness, constant worry, crime, addiction, this constant worrying, right? Um, it's sometimes called catastrophizing because we're always thinking that it's going to be a catastrophe, it's going to be horrific, and we get anxiety around it. And I often get that either around like weather, if some major storm is coming, is it going to flood? Or I find I get it a lot now with like the politics of what's going on. We're in a presidential election year. It's stressing me out, and I would imagine that it's stressing out other people as well. Issues around crime that is associated with all these other things. And so there's how it relates to choices that people make. And then also people have addictions, and, we can think about the regular addictions like alcohol, drugs, and so on. But there's also shopping addictions. There is also gambling addictions, right? There's sex addictions. So there's all kinds of addictions. We do things to try to resolve the issue. We feel better momentarily, but generally the malaise comes back after a while. So we try to do those things, but they're maladaptive. But there are other things that we can do that are more adaptive. And I'll talk a little bit about those, but definitely mindfulness, prayer, meditation. Those are some things that we already know are helpful in terms of coping. And we have a lot of cultural examples that people have used over generations, been passed down by our parents and grandparents and great-grandparents.
Dr. Cirece, can I just, I'm sorry, we had someone with a hand raised. You want to take questions now, or would you like to wait a little later?
I can give opportunities sort of when I have pauses. So that's a great idea. I was going to wait till the end, but I can do it with pauses.
Okay, we just had someone with their hand raised, and I don't want them to think we were not seeing them.
Yeah, I did not see that. Don't see the hand raised, but um, oops. But let me do a pause and I'll answer a question.
Sounds good. Thank you.
Thank you. Um, and then I already mentioned that disproportionately uh, people of color are overrepresented in low-income communities. And so therefore, we disproportionately experience environmental harm due to water quality and air pollution. So I don't want to stress you out. A lot of times when we start talking about neuroscience, people check out. Don't check out. Don't check out. Stay with me. Stay with me. The most important thing to understand is that we have learned recently from neuroscience that we are much more in control of what happens to us than we thought. We used to think that if you had certain responses, it was written in stone. That's just it. We just try to help you. We do remediation. We do the best we can. Now we know we can rewire brains. Now, I remember when that research came out, and I thought about my family and other people that I knew that I grew up with. And I was like, you ever been in a moaning bench? You ever been in Piney Woods in a little tiny church, where they don't have an organist, they don't have a piano? We get into that meditative state and have for generations. And that is one of the ways in which, at least in my community, in my culture, ways in which we know we have made it through. So it's great that neuroscience caught up with us to be able to help us to understand scientifically about what my grandparents and great-grandparents understood innately. So it's important for us to understand that there are things that are going on in our brains and that we can control it. We can uh, engage in certain behaviors that help us to counter race-based stress. That's what's important to understand. So when we think about whether or not we're experiencing depression or we find ourselves irritable all the time, or that we are catastrophizing, ruminating, we're anxious, or that we just don't feel so good about ourselves, right? That we can look at that and say, there's something that I can do right now that I know will help me to change the way I'm thinking, to change the way I'm feeling. We also know things like headaches or being hypervigilant, like people could just say good morning and we're like, there's no good morning, you know? So we can be ready for someone to do harm to us, even when they're not. And so we can be really hypervigilant about that. And so we need to pay attention to those things. So I'm going to show you it's a very short video, and it's one that I made for when I'm talking to parents, mental health professionals, educators, or community people about Black children in particular, but it applies to all children of color and what it is that they might be dealing with. So let's see it.
I think we all know that Black children experience racism daily. What we may not realize is that these cumulative experiences with racism significantly impact their socio-emotional development, decision-making, and academic achievement. Maybe this is why suicide rates among Black youth has risen to alarming rates.
Yeah, so
I think we all know that
that last part there about rising rates of suicide, it's important to understand that for Black and brown children, that their suicide rates have doubled every 10 years. That's alarming. That's alarming. And we as adults need to ask, what's causing that? And we need to talk to them. We need to seek their voices and their narratives about what's stressing them out. And what I'm going to show you today is that begins as early as early childhood. So I'm going to pause here and see if I can answer a couple of questions about what I've talked about so far. Stop the share. You're on mute.
Yeah, Candace, you had a question?
No, I didn't have a question. I'm not sure.
Your hand is up.
I'm sorry.
Okay.
Maybe the button was pushed on accident. I apologize.
That's okay. It happens. Thank you for being here.
No
That's great.
problem. Grateful to be here.
Oh, thank you. Thank you. Let you know that we're listening and we're paying attention. I love it. And well, while we paused, I mean, did anyone else have a question?
I don't see any hands up.
Okay. Well, we'll just
Oh,
keep it.
wait, we have one, but Maya?
That.
Hear me?
Yes, we
Yes.
Hi,
can hear you.
thank you so much for coming. This is taking me back to grad school, so I signed on because I wanted to continue to be current. Sociological issues are always current, just expanding and going deeper. And I want to thank you. But I was thinking about race-based uh, distressors, and trauma, and I have been vacillating with the word cultural competency. I work for a state agency, and I was told by one of the trainers that they're using the term replacing competency with impact. And I went further to say, well, maybe, you can't be impacted or competent if you're learning. So how about cultural sensitivity? So we're open to that so that it can impact us. But then I also then crossed the street to the therapists and the licensed LSWs and the counselors and medical professionals whom are not melanin, and how this cultural sensitivity and this race-based trauma is addressed in therapy, or bedside manners with social workers at the hospitals or psychiatric, units. I am I'm wondering how that ties into addressing it with our young people, especially considering the suicide rate. Um, I just wanted to know if you could talk about that. Again, it's just the cultural sensitivity of those that are not.
Yeah.
Basically, what I'm saying is, let me just keep it real. White men and white women, and younger, the intergenerational connection of these young therapists that are Caucasian and or have a different background and don't know anything about what you're talking about right now as it relates to African American children.
Yeah.
So
Yeah.
that's it. That's the short of it. Thank you.
Thank you. Thank you. So that's a great question. So the term that we use actually is culture centered. And
Mm.
actually our tagline with our company, with Crest Program, is placing culture at the center of trauma-informed care. And we do that because we understand, first of all, that we have over 3 decades of research around racial cultural identity development and its relationship to, its correlation to overall well-being and to academic achievement for kids. So we know that when people have a strong sense of who they are and understand what their value system is, and they have a positive group reference point, in other words, they love themselves, they love their reference group, right? So, and they have positive self-esteem. They have a great ability to choose good peers. They have low conflict with either authority figures, low conflict with other students, with peers. And as I said, they outpace other students academically who have not demonstrated the same strong racial cultural identity development. So we already know the keys to success. The research is already there. So we know that it's important, if we want our children to be sane and healthy and to be able to protect themselves and also to have some responsibility to their communities, uh, once they are educated, that it's important that we inculcate them with a very positive view of themselves and their reference group. So culture-centered is really important in that. So that's why we talk about exploring culture-centered theories, whether we're talking to mental health professionals, or we're talking to educators, or we're talking to parents, right? About really about decolonizing our training. So Maya, you mentioned that a lot of these folks are, white counselors or white social workers, white mental health professionals. But honestly, we all have been trained with the same books and the same folks. So that means we're all needing to decolonize. We may intuitively know something's wrong, but where's the accountability? I don't know what people are doing when they close the door and they're working with people. So I would rather that we open up the discussion, have a conversation, take a look at what researchers and scholars have done to frame, Latino counseling theories, of African-based counseling theories, of looking at indigenous ways of knowing to work with Native American children, an Asian-centric theory. We don't even cover that. I don't care what the area is. Psychology, social work, counseling, I don't care what it is. It's not.
Oh no, did I freeze or did Dr. Cirece freeze?
I think Dr. Cirece froze.
Okay, we're having a short tech issue. Please be patient with us. I'm sure she'll be right back on. Text her, I don't even know if she knows that she's kicked off. Is anybody else having issues with AT&T today? Yeah, AT&T is crazy today.
Yeah, am I
Are
back?
you back? You're back. I was just texting, you're back.
Oh my goodness. It's crazy. So basically what I was saying is that we've all been trained with the same textbooks, with the same framework. And so we all need to be decolonized in the way in which we think about working, in whatever it is that we do. And that is what we've dedicated ourselves to, being able to do that. And you'll see that reflected here today. So we believe in culture centered, because that allows us to be respectful about people's values and to ask questions, to be curious about ways in which people cope and have coped, and use those and integrate those into the work that we do with them. So when I work with parents, for example, I don't come in and start telling them how to parent. Instead, I ask about, what have they learned? What are narrative stories that they have about, parenting, and, how does that relate to how children uh, are raised, and are they getting the kind of outcomes that they want? And we try to stay with their frame of reference rather than creating something new, bringing them something new. It's always important. If we do that, there's going to be reinforcement within their own family, within their own community. When we bring in something different, then when they bring it back to their family and friends, people are looking at them like, what's that? We never heard of that. That doesn't make any sense. Why are you listening to those people? So they're not getting the support that they need. What I like is, when I used to do therapy, I liked working with clients and helping them, and grandma coming in and saying, that's what I said, right? So I love reinforcing these things that are adaptive coping, that are recognizable in the community, in the family, rather than bringing something foreign. Even if it's something that's been proven to work, you still have to educate people to something that's outside of their framework. Then they're bringing something in and it's not supported by their family members. So I say, try to find out, what do they do, find out how they operate, find out what's adaptive about what they're doing, and try to use that and apply that. And if there's something else you want to add, you can go ahead and do that. So yeah, so that's what we do. And let me just say this, that Maya, that very question you're asking is what we'll be showing people when they come in May. So we'll be showing them how to do that, how to change the way you operate and place culture at the center of what it is that you're doing. Yes, Sarita.
Thank
I
you.
just wanted to say, thank you, Maya, for the question. I just wanted to say, Maureen, I'm going to ask if you would, I see your question in the Q&A, and I'm going to ask you to hold on. We only have 15 minutes, and so we wanted to let Dr. Cirecie try and get through some more of her presentation, and then we'll make sure that we follow up. We'll answer your question, Maureen, okay, before it's over. Thank you so much.
Yes, that's a good point. So, yeah, so I just said all of this. This is all the scholarly ways to say it, but we just said it together. I'm going to go to this. So let's take a look at what I was saying about what's going on. What we understand is that preterm birth is the most common cause of infant mortality. And when we look at mothers of color, we disproportionately are experiencing preterm births, right? So it's important for us to really think about what's impacting mothers, what's impacting maternal health. And what we know from the research is that race-based stress is associated with these issues of preterm birth, right? So we know that our children are experiencing this distress even before they get here. And then once they get here, we also have disproportionate rates of low birth rates. So we've got that as well. So even when we get here, we're starting at a deficit. We are fighting for our lives in order for us to move forward. And then as we move through our early childhood years, we're also impacted by the messages that we're getting. If we're taking them to daycare and preschool, already we're starting to introduce mainstream values and place our children in the margins. So children are getting a message all the time. One of the things that I used to get when I used to work with young children, at one point I had a contract to work with Head Start in New Orleans. And there are, at that time, there were 27 Head Start centers. So we did the assessments and we also did the interventions and so on. And parents used to come to me and they would be concerned because their child would come and they would read these little books, the children's books, and the child would point to the little white hero and they would say, you know, I want to be white. And they would be so concerned about that. And I said, what your child is saying is, I want to be the hero, but the kids who look like me are never the hero. So I said, well, you know, first of all, great ego, that, you know, great sense of self, that they want to be the hero and they recognize that in the story. Awesome, right? But I turn to the parent and I say, are you intentional about the books your child is reading or even looking at the pictures? Are you getting books where children who look like them are the hero of the story? Right? That's important. So I did that with my own children, but I also bought books that also showed other people of color, other children of color, so that they could get used to that too. So it's not just you expect that you're going to be at the center, but also little Latino children, little Asian children, and little Native American children can be the hero of the story. It's important. So what do we look like when we see in infancy and toddlers? What do we see that should be of concern to us? When we get the inconsolable crying, instead of us being agitated by that, we should be curious of what is causing the distress. Are they picking up on our anxiety and distress related to racism? I don't know. Disorientation, diminished interest in toys, aggression. I used to get a lot of people asking me about children biting, kicking, hitting, right? And deal with that and withdrawal from peers. And then also seeing how they could be engaged in an activity and then all of a sudden get very distracted and just drop the toy and stare out into space. So we need to be very concerned about those things and begin asking questions about how they're currently being impacted. So the lens that we use is continuous traumatic stress lens that allows us to look at what happens when you have trauma that endures. And then I talk about these 4 points, right, of understanding race-based stress as pathological, meaning it's sick, understanding that it's present and future oriented rather than past. It's unpredictable, could happen anytime and mess up your day. And it happens when nobody's going to bring you justice, right? So getting to the solutions, so I could try to answer some questions. So I already said that culture. Placing culture at the center is really important. It allows for a deep structural resistance. Now notice structure, I'm saying that word again. So we know we're dealing with this issue of structural racism. The solutions are also structural. So we need to deal with deep culture, history, culture, environment, and the psychological. On all of those fronts, do we need to be dealing with it? So, you know, I developed these 10 interventions. I wanted to show you one, but I don't think that we have time. But I think that some of my staff are here and they might be able to do that, to put a link to this. But what's important is we'll be doing the face-to-face skill-based training in May. We're going to do some of these activities. So I'll be coaching, my team will be there, and we will be showing folks how to use it, whether you're a parent, right? And you want to know how to incorporate these things, because it's better. It's better when parents can intervene and not just all the time, just constantly, when there's something different, just bring them all the way to a professional. Some things parents can deal with if they're properly trained. So we'll be going through some of these, not all of these, but some of these in the training in May. So yeah, I said I
Hi,
wanted to,
my name is
but
Dr.
I won't be
Cirecie
able to do this.
West-Olatunji,
Let me see
and I
if
am
I can, right. So I wanted to get to the questions. And yeah, so that really is this. I want to turn this back over and then maybe look at some of the Q&As that you guys sent in, and I'll look at the chat while Sarita takes over and takes the lead again.
Thank you. So the question we only have one in the Q&A right now. It is Maureen Jones asks, do you consult with agencies such as Department of Children and Family Services to help with sharing the methods that you have described?
Yes, absolutely. So even though we have the online communiversity, we do provide a consultation, and we can do that live remote, where you gather your folks together and you have a screen, and we provide it, and we typically also include a resource packet that folks can use. We love to provide assessments because folks say they can't find race-based assessments. There are lots of them for children even. So we have those. I've developed an instrument for parents called the Parent Proficiencies Questionnaire that's based on cultural norms and so on. But yes, we also go. So we will be flying to Maryland next month to work with a school-based mental health group with an organization. And we'll be flying to Florida later on this year to do a 2-day intensive with a group of community outreach workers who are dealing with trauma in low-income communities. So, yep, we can come out and customize and come out to you.
She's also coming to Be Strong Family sometimes in the next couple of months to do staff development with us too, professional staff development. So yes, Michelle asked, and I just want to say, I see your team is great. They are dropping the chat already to the upcoming institute. So this is just a taste. Today's webinar was really just a taste of a larger workshop being done collaboratively with Dr. Cirecie, with CREST, and with Be Strong Families. So you want to sign up early because space is limited. You want to get there. You don't want to miss out on this fantastic opportunity to take this conversation deeper with Dr. Cirecie. I'm going to go back. One of the questions, Michelle said, what recommendations would you offer to mitigate parentification?
Oh, parentification. Yeah, exactly. Yeah, so a lot of that has to do with attachment theory. And I had the opportunity to work with a colleague of mine who is of Asian descent, and he wrote a beautiful book of looking at attachment theory from a cultural perspective. And so I think I was asked to write an endorsement of it, and I was so impressed. That's exactly what needs to be done. That's the decolonization thing of how do we talk about attachment from a cultural perspective. So in thinking about that, the parentification has a lot to do with trauma, right? So it's definitely intervening and taking a look at what's going on about attachment, of what's going on with the parent, and whether or not the parent has needs that they're trying to meet with their children. And it's also recognizing that when children are parentified, they are not allowed a normal or healthy childhood to be children. And that's a really important thing. So we don't want to rob them of that. And so it's about retraining and reteaching. So one, it's intervening to find out what's the trauma and how do we intervene and remediate for the trauma. And then it's also protecting the child and bringing more safety to them and ensuring that their growth and development doesn't take a detour, that we return them to the expectations of what it is that they need to do as children. But that takes, I'd say, aggressive intervention in working with the parent. But I would say still, even that needs to stay focused on cultural values.
Thank you, Dr. Cirecie. Andrea asked, could you restate what you had on the slide before the deep structural resilience slide? I don't know what
Let's see. Yeah, so I talked about the role of culture and the need for people reconnecting people to the resilient strengths of their ancestry and culture. And, I think that gets commercialized a lot, where we talk about ancestry and things like that. But it's really about making sure that children hear stories often, frequently about the people who've come before them. They need to hear stories of resilience. So they need to hear how they've overcome. And it needs to be told in family stories, like orally. It needs to be written down. It needs to be in children's books. It needs to be in the movies, the cartoons that they watch. It needs to be constantly sent this message of understanding and reconnecting with the strengths of the community. The second one is it acknowledges the history and the struggle of oppression. I talk to a lot of folks from culturally marginalized communities. Even I've done work in Japan, I've done a lot of work in the Pacific Rim. And in talking to oppressed people in Japan, I would ask them the same question of, like, how come you don't talk to them about the issues of oppression? And they're like, well, we don't want to bother them. It's like we want our children to have a better, happier existence. But the problem is that you don't arm them. So that means that when they are confronted with racism, they got nothing. They are just down and out for the count because we didn't prepare them. So we need to talk about what's happened and what it is that we need to do about it. And then finally, I'm reading this from my printed version. Practitioners must move beyond surface structure to the deep structure. So that's what that one was, of about deep structures. Those are the three things on that slide before the big deep structure.
Dr.
Resilience.
Cirecie, it is 1 o'clock. People want to know, can they have this, can they have a copy of the slides? The question was coming up several times. I couldn't remember what you said. Are the slides available for them afterwards?
The not the slides, but the PDF. I'll send that
Okay.
to you so they have the PDF. But honestly, I'm telling you, come to New Orleans.
Come to
It's
New
like you're gonna have a
Orleans.
good time. If you want to really know how to do it, if you want to take this back to your community, right?
Mhm.
If you think your staff, if you think your group needs to be about this, come yourself and get the
Yes.
information and bring it back.
Yes, it's going to be live. Rachel said, what's the name of that book? Whatever
Which
book you
book?
suggested. Which book, Rachel? And while we're waiting for Rachel to respond, next slide, D, so we can close out.
Oh, on
Attachment through
attachment
different
theory.
cultures. That's it. Okay.
Yeah, I'll have to look for it and I'll give it to Be Strong Families. And so maybe there can be, when we send out the PDF, I'll send out the name of the book.
Sounds good. I got you. May I see you? You want the PDF? Yep. We'll ask it for anybody who wants it. Just reach out to myself or D. And I want to encourage you. Thank you guys all for joining us. Thank you, Dr. Cirecie, for a fantastic presentation as usual. And we're looking forward to people joining us for the in-person. Show up. You won't be disappointed. And there's a lot of stuff happening in New Orleans all the time. So if you come to the workshop, then you get to take advantage of all the other great things that New Orleans has to offer. So please come join us for our upcoming webinars, Parent Influence, or you become parent leaders. This is being done by our National Parent Cafe leadership team. This is a group of parents from across the country who are coming to talk about it. And this is in honor of National Parent Leader Month. February is also National Parent Leader Month. So please come to support them. And then positively impacting addiction by training and empowering the family. This is with, oh, dang it, Pam, what's the name? Kayla Solomon and Dominique. I'm trying to think of the name of the agency. Oh, I can't think of it, but join us. And then Authentic Feminine Leadership is scheduled for July 31st, and that will be with Monica Monet and our very own CEO, Kathy Getz-Wolf, Catherine Getz. So please, Allies in Recovery, thank you. Positively Impacting with Allies in Recovery. You can use the QR code and sign up now for any of those. Next slide. Is that it, Dee? Uh-oh. Oh, and don't
This
forget
is
our
the
Taste the
Taste the
Cafes
Cafe slide.
3 times a month. We have Taste the Cafes. These are upcoming cafes. You want to be there. These are fantastic. If you've never been, pop in, join us. Just know that you have to come to participate because we don't do observers, okay? We had somebody really upset last week. She wanted to observe. You got to experience cafes. You can observe them. All right? Use the QR code. You can register today. And what else you got, Pam? I mean, what else, Pam? Lord D. Thank you. Thank you guys for all of you guys who were able to hang out with us past 1 o'clock. If you're looking for people to do great work and to share their expertise, visit our speakers and teachers page, okay? You'll find out how to contact these people, and also Dr. Cerecie's information is also on there, okay? And did you guys answer all the questions? Can you send a notification for New Orleans? Okay, great. Our newest product is here. If you haven't had a chance to check out our coloring book at Be Strong Families, we have a Living the Protective Factors Coloring Activities book. It's only $10. It's amazing, guys. It has like 5 different, it follows a journey of 5 different children of different ethnicities through their week of having a rough day and how they bounce back and got friends and all that great stuff. It's really a great resource. If you're working with children, this is a great resource. Next. We are still doing bulk discounts available. So if you want bulk discounts, we've got good. If you want to buy bulk, we have great discounts for you. Okay. So 10 to 20% off. You're welcome, guys. And thank you guys so much for joining us today. If you have benefited from or value what we do, please consider donating. Be Strong Families does we bring great content. And so if you'd like to support us and continue to do the work that we do through cafes and parent engagement and these great webinars, consider donating. Okay. We appreciate you. We appreciate you showing up and being with us since we started these for the last 3 years or 4 years now. Wow. Wow. Thank you guys. Thank you for making this possible. We appreciate you all, and we're going to sign off. Dr. Cirecie, again, thank you. And to your wonderful team who's been active in the chat, thank you very much. We appreciate all the energy. And thank you, Dee, for providing tech for us. And guys, with that, we're going to sign off and have a great rest of your day. Yay.